Local health departments planning for potential COVID-19 booster rollout, but there is still some confusion. Last month, U.S. health officials announced plans for booster doses of COVID-19 vaccine to be offered starting the week of September 20th, subject to sign-off from the U.S. Food and Drug Administration and the U.S. Centers for Disease Control and Prevention. Those conversations are getting underway this week, including a key meeting of FDA vaccine advisors on Friday, but the decision isn't a slam dunk, experts have said. Still, those tasked with administering boosters can't wait for the details to be finalized. The last thing local health officials need at the moment is more chaos or confusion, but many of their questions around boosters still have not been answered. What is the interval for boosters? Is it any shorter than 8 months at this point? What is the age cutoff? Will there be priority groupings? Freeman said. We don't want to appear uncoordinated on boosters.
What has to happen before boosters go into arms? The FDA's Vaccines and Related Biological Products Advisory Committee will meet this Friday to discuss whether data on Pfizer-BioNTech's COVID-19 vaccine support the idea of giving a booster dose to people 16 and older about 6 months after they complete their second dose. And there will be more steps before boosters will be okay to go into arms of the general public. 100% we will wait for FDA approval, we will wait for CDC approval. Klain said that even if boosters of both shots don't receive full approval before September 20th, the administration would still be ready to distribute them by then. What could distribution look like for additional doses? The rollout plan for boosters won't quite resemble earlier vaccination efforts, where pharmacists went to nursing homes to vaccinate residents and stadiums held long lines of people waiting for shots at match vaccination sites. There's still a lot of emphasis on pharmacists to continue to play a strong role in administering vaccine, and over 70% of doses are currently administered to pharmacists and ACCHOs, Freeman said, but she added that in some states, certain pharmacists and hospitals may not participate in the booster programs because they won't have the staffing capacity to do so, among other reasons. In those cases, boosters could be administered at other sites, such as doctors' offices or specific vaccine clinics. It could look differently state by state, Freeman said, but she emphasized that there is no limitation or constraints on vaccine supply. How many people might be eligible for boosters? It's not clear what parameters the US booster program will have, if it launches at all. The Biden administration previously said US residents would be eligible for a third dose of COVID-19 vaccine 8 months after receiving their second dose. In that case, up to 5.2 million people may be eligible to receive a booster shot, or third dose, of the COVID-19 vaccine during the week of September 20th, if the booster program began then. Data from the CDC shows that about 3.4 million US residents were fully vaccinated by January 20th, which would make them eligible for a booster shot 8 months later on September 20th. Up to 5.2 million people may be eligible for their booster shot by the end of the week. More than half, 56%, of the doses administered by January 20th were Pfizer-BioNTech doses, data from the CDC shows. In December, the FDA authorized the Pfizer-BioNTech vaccine for emergency use about a week before the Moderna vaccine. Public health officials and medical experts at the U.S. Department of Health and Human Services noted in a joint statement in August that the booster rollout could be phased by default since the initial rollout of first doses was phased. For instance, if the boosters are recommended for people 6 to 8 months after receiving their second dose, healthcare workers and older adults would likely be the first eligible group to receive booster shots if a rollout happens next week. If someone received their second dose in January, that was 8 months ago. March was 6 months ago. At that time, the individuals who were fully vaccinated earliest in the vaccination rollout, including many healthcare providers, nursing home residents, and other seniors, will likely be eligible for a booster, the statement said. We would also begin efforts to deliver booster shots directly to residents of long-term care facilities at that time, given the distribution of vaccines to this population early in the vaccine rollout and the continued increased risk that COVID-19 poses to them. The FDA and CDC previously signed off on allowing third doses for people who are immunocompromised. More than 1.9 million people have already received an additional dose since mid-August, according to the CDC.
Thank you for watching. Please subscribe.